As urologists, we deal with a variety of conditions in men, women and children, mainly to do with the urinary system and organs including the kidneys, bladder, prostate or external genitalia. The symptoms we commonly see in our clinic, patients present with are difficulty in passing urine. They might have frequency or urgency of urination. Sometimes they have hesitancy, and patients might present to us with recurrent urinary tract infections, blood in the urine. They might get pain related to the kidney, which could be an early symptom of kidney stones. There are some patients who come to us with tight foreskins, lumps on the testes. So there are a variety of conditions we deal with. Some of these patients might initially present to the GPs and we get a referral from them, or they come and see us directly. We also do a variety of screenings for urological cancers, and the symptoms, the red flag symptoms for these could be blood in the urine, a raised blood test for prostate, which is called the PSA. If you have any of these symptoms, or if you're worried, do please come and see us, and we could do a detailed assessment, run a variety of tests depending upon what symptoms you present with, and accordingly formulate a plan of management and treat these conditions.
The first consultation with a urologist is an opportunity to meet the team. You usually meet your lead consultant in a clinic room at one of our associated hospitals. We understand that patients might be feeling a little bit anxious because it may be the first time you've come to a hospital or indeed seen a doctor or a specialist in a hospital. But we will try and make your experience or time with us as easy as possible. On the first clinic visit, we will discuss the problem that you presented or you've been referred with. We'll go through the duration and any other symptoms or signs that you may have or you wish to talk about. We'll go through your past medical history, looking at what medication you may be taking, any allergies that you might have, and any risk factors such as smoking or alcohol intake. We'll then proceed on to an examination. In the examination, a nurse will often be present to help chaperone us, as it can be quite an intimate examination at times. The abdomen, in the man, we may examine the prostate. In the lady, we may examine the vagina as well. But the abdomen and external genitalia are usually examined. We then usually go on to test the urine, either for signs of infection or blood if it's present. Some basic tests may be done on the day, such as a flow rate and residual. This will measure how fast you pass urine, indeed if there's any blockage, and how you empty your bladder. These are usually the basic tests that we can give you results for straight away. Depending on your presentation, we may then proceed on to some more advanced tests that we can go on to talk a bit later. Often when you come up to your consultation, some people find it quite anxiety-inducing, and it's sometimes if you have a condition that's been going on for a period of time, it might be better to just write down a few notes before coming up to see your urologist. You may either wish to forward it onto our secretary before your appointment or bring it into your urologist during the appointment, and they can have a read and find out how your condition is and how it's been bothering you. Any previous correspondence or any letters from any specialists that you visited before would often be very helpful, especially if you've had any tests such as an ultrasound scan or a CT scan at another institution. A list of your current medication is also very helpful and will tell us if you're on any drugs, for example, drugs to treat your prostate. If you're on any blood thinners, this is important to know because some of the tests may require us to stop some of the blood thinners for a period of time. A list of your allergies are also very important to us. On the day, it's important sometimes to come with a full bladder so we can test your urine for signs of infection or indeed blood. And sometimes, if it's possible on the day, we may get you to do a urine sample in a special machine that measures the flow and indeed checks how you're emptying your bladder afterwards. We often may get you to fill out a questionnaire, such as an IPSS questionnaire, which measures the severity of your symptoms from prostate conditions, or indeed a 3-day bladder diary, where you measure how much you drink and how much you pass in the form of urine. It will tell us if you're waking up at night or you're passing large volumes. This is all very, very important information for us to assess and help make a diagnosis of your condition.
After your first visit, depending upon the condition you present with, you might need further tests. These tests might include an ultrasound scan a CT scan or MRI scan. Some patients do need an endoscopic test, and the commonest endoscopic test in urology involves a telescopic examination of the bladder, prostate, or the water pipe. Female patients sometimes need vaginal examination along with the endoscopic tests. Depending on these test results, you might either be started on medical therapy or some patients to get listed for surgery. If you do need medical treatment, we will ensure that you have a follow-up visit to assess the response to treatment. If you do get listed for surgery, we'll make sure we discuss all the details of the surgery with you, and you might need some preoperative tests to make sure you're fit for surgery.
Patients come and see a urologist for a whole variety of reasons, and typically a consultation will last between 15 and 30 minutes. But it does depend very much on what the patient comes with and what their concerns are. Sometimes patients already have a diagnosis because they've seen a GP and they've been told they have a cyst on their testicle, for example, that needs removing. So examining them is usually straightforward, and establishing a plan may not take that long. And sometimes patients are put straight onto a waiting list there and then, but that's not always the case. Sometimes patients come with signs such as blood in the urine, and that's a red flag symptom. And there's quite a prescribed series of investigations that a patient would go through with that symptom. And so the initial consultation would be about counselling the patient about the further investigations and consultations to come. Sometimes patients come with symptoms such as urgency, not being able to get to the toilet in time, recurrent infections, or incontinence, in which case there's a series of assessments and investigations that the patient and the urologist need in order to make a diagnosis and make sure that the patient's on the right track for treatment. But the important thing to remember is that no matter what your problem is, we are used to dealing with complex problems, and each patient is going to get the time they need to make sure that they've been heard and that we get the investigations right.